Could you first just tell us what you were dealing with that caused you to meet Christina?
Sure. So it was one of these before and after moments. At least from what I felt, it turns out it really wasn't, but I took a fall on June 22nd of last year. I was kind of leaning over, squatting over to leash up my dogs, and they're not big dogs, but somehow they made me lose my balance and I fell flat on my face. And so for the first day, I was concerned I'd broken my nose. My concern was my face, which was all bruised. It turned out that was the least of my worries. So I began, at some point, I realized I was in a lot of pain, and pain was not a normal situation for me to be in. As I subsequently shared with Christina several times, I was just one of those very kinds of healthy people. I mean, the last time I had a cold was 2005. People ask me all the time what I do to kind of stay healthy. So this was a real shock. So finally, it didn't go away, and I thought I might have to see a doctor about this. And so I went to my family doctor, and she put me on a course of muscle relaxants and a steroid pack, I think. And I went back 2 weeks later. It wasn't any better. And she put me on Celebrex then. And I knew that was a drug I didn't want to stay on too long, in addition to which it wasn't doing me any good. So long story short, she finally referred me to get an x-ray. And now with patient portals and everything, I saw that x-ray as soon as she did. And I didn't understand the x-ray itself, but I did understand what it kept saying, severe this and severe that. So I thought, oh, I have a real problem here. So she then referred me to a neurologist, and given the days of COVID, it took a while to have the MRI and the EMG and the EEG and everything else that he wanted to do. And before he understood what my problem was, and referred me to a neurosurgeon. And I'm sure these are the steps that most patients probably go through, but it was interesting. So at this point, I am, since June 22nd, pretty much 24/7 pain, and pretty high level of pain. I mean, it was hard to concentrate and read a book, and it was, layers of pain. So I was like, what does somebody do about this? Well, the neurologist, before referring me on to the neurosurgeon, did give me an order for physical therapy, and said on my way out the door, it's going to be really important for you to do this. So I did. I got in touch right away with the bricks and mortar place that Christina referred to, although I unfortunately did not yet see Christina. So I went through physical therapy. I didn't quite understand fully, in hindsight, the nature of my situation. I didn't know what I didn't know. I just knew I had a neck issue and I had to get some treatment for it. So I went through, dutifully went through physical therapy and appreciated it, and did all of the homework and exercises. But I was kind of noticing that I was going through the same steps as the person next to me who'd had a stroke, as the person on the other side who'd hurt his hip on his bicycle. And even though I'd always feel a little bit better when I left, I was still in 24/7 pain, and it was not getting any better. And in fact, it was getting worse because my ability to handle it was going pretty much downhill. So after about maybe 2 months of that, one of the physical therapists there said, we have a new person that I think could really be helpful to you. And voila, I met Christina. And we had one session, which was, as I recall, and please correct me if I'm wrong, Christina, but it was sort of like an intake assessment kind of thing. And then toward the end of it, she had me do just a couple of different exercises, and they were very different than what I had been doing. And I had a good feeling about it. And I had an appointment to come back twice the following week. And it was the day after that that I was sitting in my office. I mean, right here, I was sitting here, and all of a sudden, for the first time in 4 months, 4 months, I was without pain. And it didn't last long. It just lasted 10 or 15 minutes, but it was truly the first time in all of those weeks, months, that I was momentarily without pain. And that gave me this feeling that, this was something that maybe I could have some control over. That, I mean, this was the first time. So that's kind of my story up to when I met Christina.
Yes, thank you, Dulcy, for kind of giving us that time frame and those providers that you sought help with, and whether or not those treatments and interventions, the medicine, the Celebrex, the conventional physical therapy, and the failure of those to give you much relief, at least any kind of lasting relief or complete relief. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.